Good.
So if everybody is now all of a sudden watching, we just popped in. We're ready to go live. This is Meat, Body, and Soul. I have rebranded from Get Fit with Jodelle to Meat, Body, and Soul. And I am excited to have my very first live podcast that I'm doing with someone who is so willing to come on and do that. Now, we're actually talking about today is sleep. I've got my sleep expert on today, who I consider my sleep expert anyway. I've followed you for a while, and you have such great information, Julia. So I'm so excited to get started with you. But before you dive in with me, I wanted to give everybody your bio, which is amazing. By the way, this woman does it all. So Julia Worrall is an RN with over 25 years in critical care, psychiatry, and the dental sciences, as well as a master trained breath as medicine provider. She's editor in chief for the Best Sleep magazine and sleep health coach as well. So she's published, author, and speaker, and I could go on and on with her bio. All the things from working with professional athletes as well as running 2 holistic bio spas and retreats in Puerto Vallarta. This woman is so impressive, and I find her information nothing you've ever heard anywhere else, which is why she's so valuable to me. So, Julia, welcome.
Wow. Wow, that's a great introduction. Thank you so much. Thank you. I appreciate it.
Oh, yeah, my pleasure. Thank you for coming on. So you got into sleep for what reason? Like, did you start out with sleep issues? Is that what drove you to get into that?
Yeah, I mean, I was working as a nurse in the emergency room and we did shift work. And I would notice that the first night I would go home and I'm dragging, like fall into my bed, dead asleep. Second night was a little bit easier. But by the third night, oh my goodness, I would go home wired, could not sleep.
Mm-hmm.
And it'd take me 2 weeks to get back into my sleep cycle, only to, of course, go to night shift again. And so it started to send me on this path. Um, and when I would talk to the doctor about how I was feeling about my insomnia, my inability to sleep, and then not only that, I became really hyper. So that I'm going to work and I'm telling all the other nurses, you go take a break, I'll cover you, I'm fine. I mean, I was like wired. And my doctor started to whisper about bipolar. And I was like, okay, I don't have bipolar. There's a clear pattern to if I
Mm-hmm.
don't sleep, this is what happens. And if I do sleep, I don't have those issues. So I started to wonder about the role of sleep. I actually also struggled with migraines terribly all through the years, like since probably the age of 9 or 10, I had migraines and I had surgery when I was 17. I was on every medication. I struggled with it for years. And meanwhile, I work in the healthcare setting. So I
Mm-hmm.
had access to all the best drugs to help me with it, but I still suffered from migraines. Um, and it just so happened that one day, one of the nurses I worked with, she said, hey, I do the sedation for an oral surgeon at a dental office, and I'm going away this week, and I'm wondering if you would cover me. So I thought, okay, sure, why not? So as I'm sitting there, the patient's asleep, and I'm monitoring and I'm looking around the dental office, and I see a sign, a poster that says, ask your dentist about sleep apnea. And I'm thinking, well, sleep apnea is a medical issue. So why would a dentist have a poster telling people who come here? I looked at the dental offices, that's where I go to get my teeth cleaned before an event or I'm going on vacation, right? I didn't, and so I was like, why would you tell people to ask you about a medical condition as serious as sleep apnea when that should be sent to the doctor? So they started talking to me about the way that the tongue would fall back and occlude the airway, and that you could move it forward with this appliance. And that fascinated me. And I was like, how is it? I've never heard of this.
Mm-hmm.
And so I started asking more questions, and this provider taught and he lectured around the world. So I started following him, taking all his courses, only to discover that in all my years of nursing and training and education, I mean, I even went back to my textbooks and I looked like, did I miss those classes somehow? And I looked in my big, thick textbooks and there was like a paragraph, maybe 2 paragraphs about sleep and sleep apnea. And what we were advised to do as nurses is on night shift is group your care. So group your care, so you're not going in and out, and you allow at least a 3-hour window of sleep, or the very least an hour and a half. But you're kind of, that's all we learned about it. And so I just felt like all of these years without knowing that piece, all the people, I thought back of all the people and all the things they complained about and all the times we told them there was nothing wrong with them. But actually, they were all suffering from sleep apnea. All the people who came into the emerge at night with palpitations, all the people who had metabolic disease, or depression or anxiety, and all those people, because we didn't understand and we weren't taught about sleep, we actually mishandled their cases. And so, yes, it was a combination of my own sleep issues, my own headache issues, which I did not realize were connected. And then my experience of working with patients and feeling like I let them down. And the more I learned about sleep, the worse that feeling got. And I'm in the emergency room and I'm trying to tell everybody that I work with, and they're all just really annoyed at me, because they're like, even the doctors are like, if what you're saying is true, we would have learned about it.
Mm.
And there's just no knowledge taught about it. So I thought, I'm going to quit my job, travel the world and scream from the rooftops, it's your sleep. And
Right.
thinking that would be widely received, but it's been a challenge, but a very fulfilling challenge. So long-winded answer to your question. Yes, yes, and yes.
I love that because I'm going to help you post it from the mountaintops here and let's
Thank
get the
you.
word out. Let's let everybody know everything is affected by your sleep. So when we live in the society where we burn the candle at both ends and we've got these endless suns around us at night where we can just stay up all night long and we don't think it's a big deal. And I was like you, I had energy regardless of how much sleep. I could get, 3 or 4 hours of sleep in my 20s and I had energy, so I wasn't tired. And I think people feel like as long as I'm going, I'm fine. But there's so much that plays into our sleep that we're going to discuss today. It's not just about do you have energy, because we can run on hormones for a while, but they won't last forever. So
100%.
there's a few things I want to touch on, but I want to remind the listeners, you guys can ask questions in the chat at any time and we'll jump in and grab those for sure. But I want to touch on nutrition. I want to touch on the behaviors around sleep, as well as lifestyle and circadian rhythms, environment, hormones, and of course, all your tips and tricks along the way, because you have quite a few of those. So let's start with nutrition wise. I've found that many factors, including things like blood sugar, protein consumption, histamine reactions, gut dysbiosis, as well as nutrient deficiencies, all affect our sleep. So talk to us about, you maybe have seen the biggest impact when it comes to what regarding nutrition with our sleep.
People are always surprised when they meet with me about their sleep, that the first thing I start asking them about is their bowel habits. Because how your bowel works tells me a lot about how your microbiome works, and if it's healthy and if it's functional. And what people don't realize is that the neurotransmitters that you need in order to sleep are created in your gut. And so if your gut is not moving, if you suffer from constipation or irritable bowel syndrome or any of those types of issues, you have food sensitivities, those all give me indications that you may not be producing the neurotransmitters that you need for sleep. So we do testing, we do like GI map, or we do various testing of the stool to see if you have the proper microbiome. Some of the patients I see, they may be low in certain areas, and that's fine, we can boost. But other people are actually completely missing certain the microbiota that produces. For example, I had a patient a couple of weeks ago. She does not have the I want to say microbiome is the whole thing, but you have anaerobic and aerobic bacteria. So she doesn't have the bacteria, thank you, bacteria to produce GABA. And GABA is vital for sleep. It's vital for REM and it's vital for your deep sleep. So since she doesn't, if you don't make it, then you need to take it. So
Mhm.
we supplement with her with GABA until we can see if we can restore that naturally. And so then we go on a different pathway of trying to get the microbiome fixed. So that is actually a huge part of what I do when I work with people with sleep.
Mhm.
Years ago, like in the late 1800s, early 1900s, the neuroscientists said that sleep is of the brain, by the brain, for the brain. And
Mhm.
so the entire focus on sleep has been the brain. And when you start off with a false assumption of a false hypothesis, and you build an entire industry or an entire field on that assumption
Mhm.
that it's all about the brain, then people are constantly trying to give medications to shut down the brain.
Mhm.
So the medications that people take actually compound the situation so much more because they're not looking at the gut. And in terms of what does the gut need for that? Well, I mean, I lean on nutritionists, I lean on people who are experts in that. And I prescribe nutritional diets for people based on what their labs tell me, whether their
Mhm.
hormones are out of balance, whether their bacteria is out of balance, whether they need more fermented foods, whether more colors, whether, whatever it is that they need. It's not a one size fits all. And I still do, and it's probably my medical background. I still believe in the numbers and precision medicine based on what the science is telling me about that person's body.
Mhm. I love that. So things like, have you seen, because sometimes when I work with people, the protein is really important. Like you mentioned, the neurotransmitters and protein, animal-based protein seems to do the best for sleep. And there's this Goldilocks of like too much, and they might be having more of that, releasing a lot from the kidneys at night so it disrupts their sleep, and too little, they're not, like you said, getting those key neurotransmitters that help promote sleep. So, what of protein, like a meat-based approach, what have you noticed?
Mhm. So there's a few things I've always advocated for fat in the diet. So
Mm,
anything that says no fat, low fat, all this stuff, it's not even, don't even look at that. Full fat, all fat, lard, butter, healthy, olive oil, avocado oil, stay away from the seed oils and those types of things, of course.
mm,
Amino acids are really critical. One of the trends that we're seeing now that's really popular are peptides for
yeah.
supporting that and the building blocks. Well, you have vegetarians. I mean, how are you going to help a vegetarian who doesn't have meat?
Mhm,
So there's different things depending on different people, but yes, carnivore diets are amazing. Keto diets are amazing. Intermittent fasting, all of it is amazing. But
mhm,
again, one of the concerns I have is when I see people calling themselves sleep coaches or health coaches or whatever, and they have like this is the path. Well,
mhm,
this is the path for a certain percentage of people, but it's not the
mhm,
path for everybody. So I'm very careful not to make blanket statements like this is what you have to do, because it depends on each person.
mhm,
Um, and I would like to dial back and around at some point in this conversation about the kidneys and getting up and going pee during the night, because I think that's a
yeah,
huge issue too. But protein, definitely what we see on labs for most people is they're very low in protein.
mhm,
And then they may start to supplement with protein powders and all of these things. Well, is that the healthiest way to get your proteins? Not all proteins are created equally.
mhm,
So yes, a huge, huge issue for people. Um, and definitely those building blocks of life, those amino acids, are critical for supporting hormone health and sleep, etc. Mhm.
yeah. And as far as like balancing blood sugar through the day, it seems like what I've noticed is what we do all day determines our night, right? So it's like keeping our blood sugar stable through the day, that helps with reducing some wake up times at night. Yeah. So balancing the blood sugar, do you find that key as well?
It's interesting that the brain is the driver of human behavior,
Mhm,
right? It's what drives us. It's we see something we like, we see someone we're attracted to, there's brain chemistry that kind of drives us. And when we understand that sleep is supposed to restore our energy. It's supposed to get us back into ATP that we've used up through the day. And so we start the next day fresh. If during the night, the sleep architecture is disrupted, if the oxygenation is disrupted, if we're clenching and grinding our teeth or we're flipping positions often, if there are disruptions and the brain is not able to fully complete its job to restore us back to our starting position, then we will crave energy. And our brain will drive us to crave and want and seek high calories, high sugar, type of foods, processed foods. It's trying to get us to eat to get the energy that we didn't get from the oxygenation through the night and from Krebs cycle and from all these other things that restore our energy. So it is bi-directional. I agree with what you're saying. If you eat crap all day, you eat sugar all day, you're probably not going to have a great night's sleep because now your body's having to deal with all of that when it should be actually fixing and repairing. But the converse is true as well. If the sleep is poor, then you're much more likely to eat the crappy food. So stopping that cycle, it requires a certain amount of determination because you're going to have to go through a little bit of discomfort and say no to yourself in order to reset that cycle.
And what about like the frequency of eating? Like, have you found that it's better for people to eat earlier in the day as opposed to a big heavy meal before they go to sleep?
That's a really interesting question. And people ask that so often. And I would say my views about food have changed a lot over the years, and especially with travel and getting to see different cultures. Because we tend to have a view in the Western side of things of these are the times that you should eat and you should stop eating at this time. And, we have those views, but you go over to Europe or you go to Central America where people eat very late at night. You go to India where they have different eating styles, Asia. So all around the world, if that was true, then we would see certain trends in certain countries with sleep, but we don't. And it's because there are culturally acceptable times for eating, and eating is a very nurturing thing. It's a familial thing. It's just, social. There are so many aspects that come to the times of eating. Now, having said that, if you're unwell, if you are trying to decrease your inflammation, if you are suffering from long COVID, vaccine injuries, you have cancer, okay, then all of those things now start to become more important because now we're starting to look for autophagy. We want to reap the benefits of having periods of time without eating that allows our body to go and fix whatever we're trying to recover from. Does that make sense? So, but for the average person, obviously, you want to give your brain and your body the best chance to repair and heal and recover. So it wouldn't make sense to eat a huge meal before you go to bed because now the time is divided, right? Now we got to digest this food that you just ate and we're trying to fix and heal and repair from the day. So logically, it wouldn't make sense to do that. But there are people all around the world that they eat very late. 9 o'clock at night is very common in some places. And yet, so we're not necessarily seeing pathology come from that, is what I'm saying.
Yeah.
I didn't answer your question.
I appreciate
because there is no
No,
one.
I appreciate that too.
Yeah, there's no one.
That is true. When it comes to sleep, it is very bio-individual, but there's something that we all do when we sleep, which is breathe. So you were talking about the sleep architecture. Let's shift now to that architecture of the breath, because you're a master breath expert that we can learn from when it comes to proper breathing during sleep. So where does that begin?
So that was one of the aha moments for me when that dentist showed me this video of taking the jaw and keeping it forward when the patient went to sleep, and it allows the air to go back. Because it reminded me of when you're doing CPR. If you've done a CPR class, first aid class, you know that you have to do that little jaw thrust, right? Tilt the head, jaw thrust, and then you're breathing or you're doing the ambu bag. So that made sense to me. And I think about how many times I would look in a person's mouth to look at their throat, see if they had a sore throat or something, but never pay attention to the teeth, the gums, the tongue, the palate. I didn't pay attention to any of those things as if they were irrelevant. And if I was doing a respiratory assessment, I would take my stethoscope and I would listen to their chest. But I never considered how the air actually gets to the lungs and does it matter. And once I started to do research, I realized it matters a whole heck of a lot. And not just for breathing, but for like your cranial nerve and brain development and how you function neurologically. So I'm going to see if I can share a little picture here. I sent you a little request to share.
Okay. Yes. We should have that now.
All right. So can you see that little picture there?
Yeah.
Does it show up? Okay. All right. So one of the things that blew my mind was realizing it's called the deep front line. And it's basically, here's your tongue, and it's all connected through fascia, through your diaphragm, your abdomen, all the way down right to your toes. So in our clinics here, we do a tongue to toe assessment is what we call it. For years, I taught a head to toe assessment. And so I've realized it's actually more accurate to say tongue to toe. The tongue directly communicates with the brain through the palate of your mouth, your upper palate. If the tongue is sitting low, then the diaphragm does not work properly, and you'll have poor balance and other issues, a host of other issues. So structurally becomes an issue. The other thing is the nose. So do you see the picture of the nasal cavity now?
Yes.
Did it switch? Okay.
Yeah.
So the air comes in through the nose. We have to breathe through our nose. Whenever you see somebody mouth breathing, that's pathological. You have to find out why that's happening. The more you mouth breathe, the less your nose works. So if this area here, the olfactory bulb, is basically the eyes for the brain. The air comes in and it senses through the air or that you breathe, whether you are safe, whether you're in a toxic environment, whether you have enough oxygen. It regulates everything for you. And when you don't breathe through your nose, you're bypassing that system. The other thing is that the air that comes in through the nose goes into your sinus cavities to pick up nitric oxide. And nitric oxide is what helps your all your vessels in your body to respond to different changes. It's your blood pressure, it's heart rate, it's all of those things. So you're bypassing that. You're also bypassing the effect of the nitric oxide cleaning the air before you use it. So it's antiviral, antibacterial, antifungal. It gets the temperature just right. It prepares the air in order to go to your brain, and then your brain can tell the body what to do. For most people, they breathe through their mouth and they bypass that complete system. The other part is the tongue. As you see, the roof of the mouth is the floor of the nasal cavity. And so many times we see that that bone is high and vaulted because the tongue sits low. And so the muscles of the cheek over time press against that maxilla, causing it to peak upward, which then takes up space in the nasal cavity and causes the bone of the nose to become deviated. So then you go have surgery to fix your deviated septum, but you haven't solved the problem, which is the tongue is not up in the roof of the mouth, shaping out the airway. So we see that with a lot of kids that, they're all stuffy and they're mouth breathing as they're kids, their teeth fall out, their adult teeth come in and they come in all crowded and crooked because the tongue is not up where it needs to be. And that space has not been shaped by the over 2,000 times that they're swallowing every day, breathing, talking, smiling, all of those things. So that becomes an issue. The other thing, let's see, okay. So the other thing is that at nighttime, if we're not careful and that tongue is weak and it sits low, when you go to sleep, it's just going to fall back and occlude that space. And then you're going to be snoring. You're going to be waking up during the night with sleep apnea, or maybe you don't wake up. Maybe your brain wakes up just enough to keep you alive, but not actually help you yeah, so your brain wakes you up enough to keep you alive, but you don't realize it's happening. But metabolically, you'll start to see changes. You'll start to see weight gain, mood changes. Children will become more irritable. You and I both talked about how when we're tired, we actually have more energy. Well, when that's a child who doesn't get enough sleep and is tired, what do we call that? We call that ADHD.
Yeah.
And then we put them on medication to stimulate them further. So yeah, so airway is a huge issue. Every sleep person, every patient that we get, even if they're not coming for sleep, every patient that we see, we start with an assessment, looking in their mouth, looking at their teeth, looking at the tongue, and does it fit into the upper palate? And people, even right now, they can just take their phone, put the camera on, and have a look. Do you have scalloped edging on the side of your tongue? Because it's not really actually fitting and it's getting pinched by the tongue. Did you thumb suck? Is your palate shaped to your thumb as opposed to your tongue? Are your teeth crowded? Do they tilt? The back teeth, as we get older, are they ground down? Do you see any grinding or erosion or broken teeth along the gum line? Do you see that there is erosion? All of those signs are pathological of what's happening while you're sleeping during the night. And people spend tons of money at dental offices to fix these things, and your dentist will very lovingly provide you with a little plastic thing to protect your teeth from breaking, but not dig deeper to find out what is the root cause of why you're clenching and grinding in the first place.
See, I told you guys you were going to hear stuff that you haven't heard before about sleep. That tongue to toe about the fascia is so interesting. So if my question with regard to that, like, yeah, the tongue makes total sense. We definitely, like, I want to encourage people, and maybe you do this as well, is like learn how to keep your tongue at the roof of the mouth. But also, if they're allowing the body to become kind of stiffened from lack of movement, from just sitting behind a computer all day, and that fascia throughout their body is tightening up, is that going to play into their sleep as well?
100%, because the diaphragm becomes restricted. And so
Okay.
you don't get full excursion of your lungs. On the cell phone all the time, the neck, whenever you see the forward neck. So look at your kids, look at your loved ones, get somebody to look at you. Does your ear fall over your shoulder? Ear over the shoulder, over the hip, over the knee for alignment.
Right.
If it comes forward, you're already going to start to get a deflection in your cervical spine. Think about a hose. If you're using the hose in the garden and you kink it, what happens?
Yeah.
Pressure goes up on one side and is lower on the other side. So now we start to increase this pressure and decrease blood flow. So it's really not good for us neurologically. The other thing is, with that forward head posture and that weakening, we tend to shorten the muscles in the front and in our chest. And so doing some good breath work to get the shoulders up and back and open up the chest and get the lungs full of air becomes super important. And the more we can do that during the day, the better it is for us at night. When we look at our kids, and even if we've had them tested, they may say they don't have sleep apnea. But for kids, what is actually more important is the flow. So if they have a low flow of oxygen, that's going to impact their brain, their ability to learn, their mood. You want to check your children when they're sleeping. Do they have their head cocked back? You ever see these kids that are like that? Well, they're performing their own CPR by tilting that head back to open the airway. So you want your kids to be sleeping with neck in alignment, mouth closed, face soft, and they shouldn't be tossing and turning and nightmares and all of those things. Those are all signs that they're actually struggling to breathe while they're sleeping. And as we get older, it becomes just more unsatisfying, unrefreshing sleep. Yeah, so it is a huge issue, strengthening the diaphragm and breathing fully. When we breathe shallow into the upper lobes of our lungs, we're breathing into the sympathetic area. That's sympathetic. Parasympathetic is getting into the deeper bottom lobes of our lungs. So big breath in through your nose And of course, always out through your nose. You
Right.
hear some people saying breathe in through your nose, out through your mouth. No, you want to take advantage of the pressure that it has to slow the breath out to get the breath into the lower bases of the lungs.
Mhm. Yeah, it makes sense because it's got filters in there. The little nose hairs are
Right.
supposed to filter out the air we breathe in. So it's not that we want to breathe in through our mouth, and it would make sense we don't want to breathe out through our mouth either. Now, so some of the key takeaways here so far we've talked about are like, yeah, we definitely want to get in protein in the right amount. We want to start keeping the tongue up on the upper palate and focusing on that breath in and out through the nose, strengthening the diaphragm with breath work. What about mouth taping? How do you feel about that? That's a big
Mhm.
movement. Do you think that that's something that people would want to incorporate?
I do encourage my clients to do that.
Mhm.
But I don't just arbitrarily say, go and tape your mouth. What I
Right.
do is I get them to work during the day with it. And
Mhm.
when they can have their mouth taped during the day and go about an activity,
Mhm.
breathing only through their nose without feeling anxious, and they can do that for at least 2 minutes straight, then I say, okay, I think you're ready now to go and tape your mouth at night. So
Mhm.
even if I'm recommending a CPAP or anything that I recommend for people, I always get them to work it through during the daytime when there isn't that pressure that I have to get to
Mhm.
sleep, because
Yes.
you're already in a state when you're in that mindset. So we work through during the day. We use peppermint oil. So first I give them
Mhm.
peppermint oil in the hand. Breathe it in, couple deep breaths with the peppermint. Tell yourself you are completely safe. This is a wonderful experience. So you're correlating the scent to
Mhm.
calm and safety and pleasure.
Mhm.
And I've learned a lot of this from Lois Laney. You can check her out on that. She's amazing when it comes to the cranial nerves. And so I
Mhm.
follow a lot of her techniques, which is the peppermint oil on the end of a Q-tip, and start putting that up your nose to get the brain turned on and the nose turned on, to just start to get this working again. And we're born as nasal breathers. We
Right.
instinctively know how to breathe through our nose, but through our habits, we got out of that. So we
Mhm.
work to get that turned on and people feeling safe breathing through their nose first. If we tape, I always tell them put a little tab at one side so you can easily open it if you need to. Don't take it off,
Mhm.
open it. Take a deep breath till you feel calm and safe again, and then cover it up again and continue. And for people who are lifelong, I remember when I was working into getting back into nasal breathing, it took me 4 months. It
Mm.
took me 4 months of effort. So I think people should realize it's not an overnight thing. When you're trying
Correct.
to repattern something, it takes time, but it is so worth the effort
Mhm.
when you have those first few nights of sleeping with your mouth closed, breathing through your nose, and you wake up feeling like $1 million, you're like,
Oh yeah.
where has this been all my life? Right. So I think it's important to do with your kids.
Yeah.
As far as taping the mouth of children, I think that you have to be really careful with that. I'm kind of
Very
nervous about that. I think it depends on the age. If I have somebody I can reason with at age 10, 11,
good.
12, something like that. But younger kids, I wouldn't do it for them. Now, I have gone in and repositioned. If I see them doing this and their mouth's open, I will reposition so the head and
Mhm.
neck are aligned and the lips closed. And I'll wait and I'll watch and I'll see. And then I'll let them go in that. So sometimes it's like physically positioning
Mhm.
them. Sometimes using a pillow that actually kind of, there was COPAP positional pillow or something like those, um, like pregnancy pillows or something like that.
Oh yeah.
The head
Yeah.
is kind of supported and aligned, and they can hug
Mhm.
onto it in the front. So positional therapy for younger ones as opposed to taping their mouth at that young
Yeah.
age.
Yeah. I want to shift now to something that I heard you talk about, the 3 a.m. wake up, which happens to
Mhm.
a lot of people. That's that time where you just can't get back to sleep. It's 3 a.m. It's the same time every day, maybe. And you have something really profound that is related to that, that maybe you want to talk about.
Well, in my experience, the 3 to 5 a.m. wake up is classically aligned with vitamin D deficiency.
Yeah.
So that, and we test for it, and everybody, I have all the numbers. I mean, you see people, their vitamin D is like 18, 20. That is really deficient. We like to see people up between 80 and 100.
Yeah.
So that is a huge factor for those wake ups. And then, and now we'll get back to the vitamin D, but also the midnight wake up tends to be associated with low melatonin. So you start taking melatonin, you can get rid of the 12 to 1 wake up. You take vitamin D, you can get rid of that 3 to 5 a.m. wake up. And this is where so many people tell themselves the story of, well, yes, I wake up at 4 or 5 in the morning, but I'm completely fine. I can get by on 4 or 5 hours sleep. And that's a story that they've told themselves. But they're missing a huge chunk. So that whole circadian rhythm thing, associated with vitamin D. And it's funny because I was on a podcast and I was talking a lot about vitamin D, and somebody commented, well, I feel like I'm in the wrong podcast here. I thought I was coming to learn about sleep, and you're just talking about vitamin D. So that tells me that there is just a real lack of understanding about vitamin D. And in fact, vitamin D is more like a hormone. It actually should be called hormone D. And when we do hormone replacement therapy and regulation of hormones, we actually get our vitamin D from our compounding pharmacy in a cream that you can put on your skin, absorb through your skin like it would from the sun, so that it metabolizes the hormones better. But it is literally the cascade for all the other hormones to function properly. And if you think about it, what is vitamin D? Vitamin D is what we get from the sun. So ideally, we should all be out in the sun. We should all be getting morning sun. We should be exposing our skin to sun. We've been fed a lie that we should be afraid of the sun, that you should wear a hat, that you should wear sunscreen, that you should wear sunglasses and stay out of the sun. And we've been fed this story that, I mean, the results just don't make sense of it. Because if you Google any, and I'll tell your audience, any illness that you are struggling with right now, or your loved one is struggling with, put the name of that illness and vitamin D and see if it comes up. All illness is associated with vitamin D deficiency. Your gut doesn't work properly if you don't have it. I mean, nothing works properly if your D is low. And when it comes to sleep, vitamin D is associated with acetylcholine. Acetylcholine is associated with what it is that kind of shuts you down, that disconnects you from your environment, that allows you to sleep. So if you don't have enough, you're never going to get into those deep stages of sleep, and you're never going to get into REM, which is where your brain gets cleared out. So everything that you take in, we talk about nutrition, all the food that you take in, and it has an impact. I would say the food that you take in and the impact that it has affects the first 4 hours of sleep. It affects the slow wave deep sleep. It affects the ability of the body to repair tissues, muscle, ligaments, all of that stuff is associated with nutritional things that you take in. When we look at the last 4, that deals with what you take in through your senses, through your eyes, your smell, your hearing, your touch, your feelings, your emotions. All of those things actually get digested during the last half of sleep. And that is where you become emotionally regulated and able to deal with life. So when people skip that part of sleep and they think they're fine, if you talk to the people that are around them, that work with them, that love them, they'll tell you they're not fine. But you don't see it for yourself, because we often don't see ourselves. If our brain is struggling, it doesn't necessarily tell us the truth, right? So neurologically, we become constipated. All of those sensory inputs that we took in were not able to be dealt with, pruned away, filed away, kept for another day, or gotten rid of. So each day we're starting at a deficit neurologically. And over time, that leads to Parkinson's, dementia, Alzheimer's, depression, anxiety, suicidal thoughts. So it's a pretty big deal if people are sacrificing the part of sleep that actually helps them to be who they are meant to be.
That key phrase you said, neurologically constipated, that makes so much sense. Like, not only would not having vitamin D do that, but like you mentioned, just not having the proper mechanism in place to like calm down the brain, to detox the brain. Even I'm assuming even things like the glial system, the lymphatic system of the brain is important. And we mentioned the position of the jaw and things like that, but what about the sleeping position of the body? Is that imperative to that kind of brain drain too?
100%. So remember I said, I always ask people about their bowel habits when they come to me for sleep because I want to know, are things moving? Is the
Mm-hmm.
lymphatic system moving and getting rid of stuff? If that is not moving, then the glymphatic system, which is on the other side of the brain barrier, isn't able to dump. It isn't able to
Mm-hmm.
move forward. So you see people then that have like Lyme disease, they get bit by a tick, the virus enters their body, it gets up to the brain and it gets stuck. It can't get out there.
Mm-hmm.
Epstein-Barr virus, all of these viruses that get stuck in the brain because it can't move. Moving is really important. How we sleep is equally important. So we do need to lay down flat. When you see people sleeping all the time upright, that's not good either. The pressure in your brain when you're flat, the flow to the brain increases 90%, which you want because the brain is digesting. And then during the day when you're upright, it goes to 10%, and the blood now is all in the digestive tract because you want to digest the food you're eating. Then you lay down, it switches again. So it becomes important. We do need to have periods of time where we lay down. Now, people who
Mm-hmm.
stay in bed all the time, that's not good either. We see that they age rapidly, they decline rapidly. So there does need to be this upright to laying down. However,
Mm-hmm.
I encourage people to sleep on an incline. So to raise the head of their bed 5 to 6 inches, take a block, a brick, some books, put it under the headboard so that you're on an
Mm-hmm.
incline of about 5 degrees, because that helps to promote cerebral spinal fluid and flow of the central nervous system and helps to take the workload off of fighting against gravity to breathe. So there's lots of good research on why we should sleep on an incline of about 5 degrees.
Mm-hmm.
Position wise, depending on your health, obviously side sleeping is really good. It's good for digestion. It's good for people who have acid reflux, sleep on their left side.
Mm-hmm.
Acid reflux, though, is also correlated with low vitamin D. The little sphincter that closes, the cardiac sphincter that closes the space between your stomach and your esophagus, is mediated by vitamin D, has receptors for there. So if your D is low, that muscle's weak. It's not going to
Right.
close completely, so you don't have that. So acid reflux, side to side is good. Incline is good. Congestive
Mm-hmm.
heart failure, high blood pressure, any of those things, again, a little bit upright is going to be better. If you have edema in your feet, you want to put pillows under your feet to elevate them above your heart to help promote flow. So we could get into all of the different positions that you should sleep in, but ultimately people are sleeping in a way that is neurologically determined. And I'll tell you what I mean
Mm-hmm.
by that. I have people that say, "Oh, I sleep on my side all night. I barely move." But when I test them, I see that they actually change position many times. And they're
Mm-hmm.
shocked to see that because they don't believe they do. But we do change position about every hour and a half to 2 hours. That is something that we do unless we take medication to make us
Okay.
sleep. Our body is keeping us safe while we're sleeping. Our brain is keeping us safe. So
Mm-hmm.
what I tend to see is people who sleep on their belly is because they have an airway issue. People who flip-flop many times, they have an airway issue. So if you think about in first aid, you learn the recovery position, where you put somebody over kind of over on their side, they have their arm and leg out to keep the airway open. Well, our
Mm-hmm.
brain will do that to us during the night if it needs to open our airway as well. So sleeping on your belly is a sign that you have an airway issue. Changing positions multiple times, waking up hot and sweaty, and those types of things is signs of an airway issue as well.
Oh, wow. See, this is so important because I feel like so many people don't think about this. They think it's just related to one thing. Like they have hot flashes, they just deal with it, or they just say it's menopause, but it could be their breath issue. It could be this sleeping posture issue. It could be a blood sugar issue. It could be so many things that they're not diving into unless they hear somebody like you say, "Hey, what about this?" So, yeah.
100%.
And
I mean,
so,
menopause is a huge switch for people. So I just want to throw
mhm,
that in there. Your risk factors jump infinitely once you have menopause because it changes, our muscle tone
mhm,
changes. So maybe you didn't have an issue
mhm,
before, but now you do. So, and the
right.
other thing is pregnancy. When you are pregnant and your muscle tone changes, everything starts to relax so that you can open up to give birth to this baby. That is a huge issue. And when those
Mhm,
moms have snoring and sleep apnea during pregnancy, those babies tend to be born with an overactive nervous system. And you're like, why can't I get this kid to settle? So I know that's a whole nother
oh,
thing. Yeah, we have a book coming out.
yeah.
Actually, I helped Dr. Shrivastava with, and it's called Sleeping for Two, that talks just about the
Oh.
implications of sleep for a pregnant mom and the baby.
Oh, that's excellent. Okay, we'll have to have you back on when that comes out. Now, shifting to what you had mentioned something before about frequent urination during sleep. And I wanted to bring up like cortisol and adrenaline, talking about hormones and things like that. Does that play into this frequency of urination during the night?
100%. 100%. So
Mhm,
how I explain it is, and this goes back to my ICU critical nurse training. The heart
mhm,
and the kidneys are best friends. The heart depends on the kidney to help him do his job. So you think about the heart as a
mhm,
pump and it's got to move the fluid through your body and it pushes into the lungs to get oxygenated and then it pulls it back and pumps it through to the rest of the body. So when we are dealing with
mhm.
patients, we're always looking at fluid balance. If you have too much fluid, it makes it harder for the heart to do its job. It's got to push harder. It's
Yeah.
pushing up against resistance. Your blood pressure goes up. If you don't have enough, then you could go into pump failure where you're like, hey, you ever
Mhm.
have a fish tank and there's no water going through it and through the pump and then it shuts down and
Right.
right.
Yeah.
So when you think
Mhm.
about the job, the kidneys now will sense the flow that's coming through. If you don't have a flow of 90/60 coming through the kidneys, well, they start to suffer. So you have to make sure you're
Mhm.
perfusing or you're giving enough fluid to the kidneys that they don't release a hormone that causes you to retain water. Um, so there's this
Mm.
interaction back and forth between the heart and kidneys. Now, how does that affect sleep? When you are ready to go to sleep, the body is designed to help you have a good night's sleep and not get up. So you should never get up during the night when you go to sleep. You should have 8 hours of peaceful, enjoyable sleep. That is the goal. And your body is designed to help you do that. So what it does is it starts to turn off your bowels. It turns down your urine production to next to
Mhm.
nothing. And it
Mhm.
starts to give you melatonin, turns on melatonin. Um, when you are sleeping and if your tongue falls back, if the airway gets occluded, if there are things impacting the ability of the heart to continue pushing that blood flow forward. So the lungs, you start to slow
Mhm.
the breathing, the tongue occludes, and you see there's no chest movement, there's no airflow
Right.
happening. The heart's pushing against that. It can't push it through. You get a stretch in the right atrium of the heart. And when you stretch the atrium, it releases it's ANP, atrial nitric peptide. That
Mhm.
goes down to the kidney and tells the kidney to turn on and release more fluid. But it also tells the adrenals to shoot adrenaline to the body so that you have a constriction of the vessels, you take a breath,
Mhm.
you open everything up, the heart, we see on the when we're testing the heart, because now you've given them a shot of adrenaline. Hey, this person's about to die. So yes, of course, the stress hormones are released, adrenaline, cortisol, all through that HPA axis, they're released to save your life. But for some
Mhm.
people, this happens over and over and over and over again every hour, and they are completely oblivious. And how we know it's happening is because they're overweight, they have weight around their belly, they're exhausted, they're depressed, they've got type 2 diabetes, they've got high blood pressure,
Mhm.
depression, anxiety. Like we see all the side effects from a headache, we see the effects of that action that is happening. And so I tell people, all day you're making excellent choices. You're getting up in the morning, you're going for a walk, you're trying to eat right, you're trying to, live mindfully, you're trying to do all these things. But when you close your eyes at night, you're being sabotaged the whole night if you're not aware of what is happening during those hours that you're trying to sleep. So
Mhm.
people really minimize sleep. But to me, that is actually the golden chain that links all those other things that you're doing together. If it's not there, good luck. You're going to be working your butt off trying to be healthy, and you're going to still feel like crap.
Yeah.
So the two should align. Your efforts during the day aligned with healthy sleep, you will be thriving.
Yeah.
Like you'll be unstoppable. We just have to start actually acknowledging and accepting. And it's hard to do that because I'm sorry, I'm on my soapbox now. It's
That's
hard to
okay.
do that because it's something that's happening while you're unconscious. And so
Mm.
people have a hard time wrapping their head around that because it makes them feel vulnerable. And it's in the privacy of your bedroom, and sleep tends to feel like a very private thing. And I don't necessarily want somebody poking and prodding at something that makes me feel uncomfortable because it's something happening to my body and I'm not even aware of it. I have no control over it. And so it can create anxiety for people when you start picking at their sleep. And
Mhm.
most people have curated an effective enough story for themselves
Mhm.
to not have to address it, right? Oh,
Mhm.
well, no, it's just because I this, or it's just because I that. Like it's amazing the stories people tell, but
Oh
none
yeah.
of it is based on fact or science. So we test, we get the data, and we show you this is what's happening. And even then, I have some people that are like, that struggle to really believe it. They're like, I don't really think I snore. How the heck would you even know? Right? I don't think I have sleep apnea. Oh, and yet the machine says that you're
Yeah.
at 88% for
Oh
65% of the
no.
night. Well,
Yeah. Oh.
eh. So it's interesting people's reaction to something, and that's all I can come to is I think it's because it makes people feel very vulnerable. And have you ever had somebody take a picture of you when you're sleeping? And you're like,
No.
oh, why did you take a picture of me when I'm sleeping? Like it feels very vulnerable. So I get it. Yeah.
Yeah,
Anyway.
I can see that. No,
But
for
yeah, you
sure.
shouldn't get up
Well,
to go
one,
pee. You shouldn't get up to go
yeah,
pee. And people will say, well, stop drinking before night. No, actually, you want
no,
to drink before you go to bed at night
yeah,
because it decreases your risk of a heart attack. It keeps your blood
yeah.
nice and thin. It helps you. No, you should be able to drink a glass of water before you go to sleep and not
Not
have to
alcohol.
impact your sleep.
Yeah, not alcohol before bed, but yes,
Right.
water before
Water.
bed.
Yes.
Yeah. I want to be respectful of your time because I know we're almost at an hour here. So maybe some rapid fire on these last ones, like behaviorally creating routines, right? Like we do it for toddlers, but then we don't do it for ourselves. What do you think about like a bedtime routine and a morning routine?
Mhm. On my site, I actually have a downloadable thing setting the stage for sleep because
Oh,
I do
good.
believe after dinner, kitchen's
Mhm.
cleaned up, everything's done. All lights in the house should go right down. Low
Amen.
lights, low lamps. I mean, you could talk about the type of light and all that stuff. That's a whole nother podcast.
Right.
But everything in the house quiets in
Mhm.
preparation for sleep. You're not getting into big discussions with your loved ones at that point. We could talk about this tomorrow. Tubby time, story time, bedtime for our kids. And then how does that look for us?
Right.
Calming activity, maybe quiet music,
Mhm.
um, but preparing the stage for sleep, yes, a lot of people, it's like you cannot be running on full throttle and then just think that you can jump into bed and shut everything off and go to sleep. And I
Yeah.
will say, for those people who go to sleep and they're like, I can't turn my mind off, that's
Mhm.
when you need to start looking at hormones and how
Mhm.
the hormones are controlling that.
Yes, absolutely. And as far as like circadian rhythm, you did mention the light, and a lot of times there's these people that are falling asleep with their phone in their hand or their tablet or the TV on in the bedroom, that's greatly going to affect like going from telling your brain it's noon all the way to laying down and going, I don't know why I can't fall asleep, right? So blue light does play into that.
Yeah, on your phone, you can have the red, like, I don't know if you can see on my phone, but you can have the
Mhm.
red filter.
Yes.
Because red light doesn't disrupt your brain like that as,
Mhm.
and the other thing is it takes about an hour and a half of this low dark lighting for the melatonin to really start
Yeah.
popping out.
Hmm.
I fully believe in supplementing with melatonin. I don't think you need to be afraid of melatonin. There are people who say, well, if you take melatonin, it's going to stop you from producing that. That's actually not true.
Mm-mm.
And it actually helps stimulate the endogenous production of melatonin. So
Right.
I never be afraid of using melatonin. 1 to 3 milligrams, in my opinion, really doesn't work that much. We use
Hmm.
much higher doses, like
Hmm.
much higher doses to reestablish sleep patterns. So light circadian rhythm, red candles, get rid of LED lights, halogen lights,
Yeah.
fluorescent lights. Try to do incandescent, which is really hard, or candles, but you'll see a huge difference. And you could reset your sleep in 5 nights if you
Yeah.
did that.
Absolutely. And I don't know if you're familiar with Dr. John Lawrence, but he also is a big, I've had him on, he's a big advocate for high dose melatonin, even in suppository form of like 200 milligrams. And so he says the same thing that you do, that there is no negative feedback loop. You actually are teaching your body how to produce more melatonin.
And the other thing is melatonin, only 5% of your melatonin is produced by the pineal gland and used for sleep. The other
Mhm.
95% is for mitochondrial function.
Mhm.
So you need huge doses. And yeah, I follow Doris Lowe, a lot of her
Mhm.
work, and we treat a lot of patients down here with cancer. And so cancer tumors cannot grow in an environment where melatonin exists. So we do all throughout the day melatonin, and we're looking at between 100 and 300 milligrams each time. And
Wow.
we do have melatonin that we use as a cream as well. And yes, you have suppositories, but yeah, melatonin, I would not be, um, I think everybody should be taking melatonin
Mhm.
because we're all
Mhm.
deficient.
Yeah, absolutely. Especially with all the light pollution that we have, I think that makes a big difference. Now, what about EMF reduction? Because that really made a difference in my sleep and my daughter's sleep. Do you promote, lessening the EMF in the house, the Wi-Fi and things like that?
100%. And I mean, we have information on our site about that. So it's EMFs, it's dirty electricity.
Mhm.
So we do have where we have one of our providers will go around and measure in your home and find out where the EMFs are coming through. You may be very careful about your house, but there may be a cell tower across the street that's pinging right
Yeah.
into where you sleep. And so
Mhm.
knowing where the energy sources are coming from, turning off Wi-Fi, cell phone electricity should not be anywhere within 6 feet of where you sleep,
Right.
which is difficult to do. And one of the things that gives out the most dirty electricity is your plugged in lamp on your
Mhm.
bedstand.
Mhm.
Even with it being off, it gives off a lot.
Mhm.
CPAP. So, I mean, I use the CPAP.
Mhm.
It gives off so much electricity. So being aware of those things, getting a longer hose, moving things away from you, and
Mhm.
decreasing the amount of exposure that you have. If you think about how many times you're on a screen or using your phone or you're exposed during the day, you should have at least an equal time of
Yes,
not having exposure.
absolutely. I love
Using a grounding sheet, all of those things are
that.
make a big difference.
Yeah, there's so much more. I think we're going to have to come back on for part two because I had so much more questions to ask you. So, because there's just so much to go along with sleep. So, and you've only like scratched the surface of the amount of information that I know you have in your brain about it.
Mhm.
So,
Yeah, and
so
go ahead.
I was just going to ask, just to kind of put everything in this beautifully wrapped present to give to those who are listening, that maybe a perfect recipe, like bringing together everything that we talked about. You need, start tonight with this, 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 and this.
Okay.
What would you say?
I think what I'm looking at right now is sleep is a family issue.
Mm,
Um, and we're looking at parents that are exhausted and not getting healthy sleep. That in turn has an effect on their children.
mhm,
And there's so much about that. And I do have a book about that, Healthy Sleep for Families.
mhm,
Because if we're not sleeping well, we're not going to establish great patterns for our children. They watch what we do. So I would say start in the morning, and we're practicing this too. Start in the morning, get up in the morning, get your kids outside if you can. If you live somewhere where you can get outside, wrapped in a blanket if it's chilly, outside, have a glass of lukewarm water, just room temperature water, have your cup of tea or coffee or whatever, but have it outside with your kids for a few minutes to get morning sun. Then get ready for the day. So that will start setting your circadian rhythm. Make it a plan that when you come home, you have dinner together as a family, talk about issues that came up, learn to communicate and let your children vent in a healthy way. Then everything down after dinner, calm activities. Try to resist the urge that everybody retreats to their own device. Try to get a board game, cards. Get back to doing things that are not screen related. And what you'll find is your relationship will change with your kids, with your family. You'll go to bed feeling a lot more loved, safe, and healthy. And that actually contributes a lot to being able to have a good sleep. Go in, say goodnight to your kids, even the teenagers, even the grumpy ones are like, Mom, get out, leave me alone. It's okay. You still go and tell them good night. I hope you have a fantastic sleep. I love you. I'll see you in the morning. And those things that I think in our lifestyle, in our busy lifestyle, our screen addicted lifestyle, Netflix binging, all of those things that we've gotten into, we're all guilty of on some level. If we could get back to some of the basics of providing safety emotionally, physically, so that our body feels safe enough to let go and have a good sleep. So I think that's what I would start with. And our bedtimes need to be earlier. We need to be getting our kids to bed earlier. We need to get to bed earlier. And I'm going to tell you, if you're used to scrolling on your phone before you go to sleep at night, it's incredibly painful to not do it. Your brain is going to be screaming for it because you're dopamine addicted to it. And so it is like working through an addiction. And we have retreats here for resetting sleep for the whole family. We do that. We hold them in Puerto Vallarta. We will do a bonfire, sit around the fire. We will do the cards or a puzzle. We help you to be under the stars and to remember what it was like before we had these devices in our hand, and help the whole family to reconnect and sleep and go home with a new pattern. So that's one of my favorite things that we do down here, because the impact of that is so huge for the whole family.
Oh my gosh. Yeah, please tell us where they can go to check that out, because I want to promote that for sure. That is so important that families can do this and kind of reboot their life, so to speak, without so many devices.
Yeah, it's a challenge today.
Yeah. So where can they find you and find out about those retreats, and then also if they want to work with you?
Yeah, so VallartaVitality.com. Vallarta Vitality, and for people, people will say it Vallarta, Vallarta Vitality, but it's VallartaVitality.com. And in there, you'll see our clinic, what we do at our clinic, what we do on our retreats. And if you want to work one-on-one, we do have memberships available for that. But sleep, I'm grateful that people are paying attention to it now. It's a superpower. You can learn to sleep well and wake up refreshed. You are miles ahead of everybody else.
That's right. And it's possible. It's possible to transform your sleep. You don't have to resign to the fact that this is the way I sleep. It's not going to get any better. There's so much you can do. And you, like I said, you've only scratched the surface of what people can do. So I appreciate you coming on today.
Thank you so much. And thank you for expressing that hope for people, because I do think that is a real issue. They are on sleeping pills and they say, I can't sleep without my sleeping pill. And it's not true. We can help you wean off of those and get a healthy, actual sleep. So yeah, big part of it. Thank you so much for having me on.
Thank you, Julia. We're going to do it again because we got more to talk about. So we're going to do it again.
Absolutely. Absolutely.
Okay. Thank you so much. And we'll just say bye for now and come back on soon.
Thank you. Thank you. Take care.
Okay.